Hey everyone. Hi, how you doing? Mick here. So today we'll be discussing anxiety and actually what it is from a life living and neurobiological point of view. Today there's a lot happening. We have the lockdowns. We got mandatory masks in some states, in some cities. Businesses are closed. People are out of work. Which all of these, it affects our sense of individualism, how we feel individually. We can't go where we want, do what we want, see the people we want to see. It's like our autonomy and self agency has been stolen. Not to mention the current political arena today and the anxiety that that's causing. Uh, so not only are we experiencing anxiety laden circumstances within the family, uh, with friends and in our personal lives, but also on a community and national level, there appears to be a lot of unpredictability. Now, anxiety is the number one most encountered mental condition in life. Uh, it's pervasive. The pervasive and continuing anxiety that some people have is it's a symptom of something else. It's consuming and everywhere. It's just everywhere within our population, and it will come mixed with other mental irregularities such as depression, OCD, which now has its own category in the DSM-5, which we'll talk about a little bit later. I'll show you that. Um, but OCD is still very much anxiety driven. Then there's trauma, anorexia nervosa, somatic disorders, addictions, and even bipolar presentations. Anxiety is a factor in all of these, plus even others. Now, I'm going to recommend if you're really interested in this, I'm going to recommend this book here. It's by Barry Wolf. Okay, it's a great book on anxiety, and I really like it because it just doesn't talk about anxiety in a very superficial way, but it gets into those things that I was talking about and how it has these other comorbidities. I want to read something here to you real quick so you kind of understand how he approaches anxiety. And this was written about 15 years ago. And Dr. Wolf is a psychiatrist, I believe, in Boston. Okay, so he talks here. When he says phobia, he's also talking about anxiety. He says individuals with phobia that their phobias may be connected to deeper issues relating to the way in which they experience their self. Second, it was apparent that some intense and painful emotions seem to lie just beyond the phobic fear, and that some people were unable to experience and articulate these feelings because of the phobic anxiety. Okay. And to understand that, I'm going to add to it this other piece here when he talks about those underlying issues. He says a deeper understanding of these fears, the anxiety and phobias, suggested that they are based in unbearably painful ways of viewing oneself, i.e., defective, unlovable, or worthless. So that's pretty interesting. He talks about the deeper issues, which we'll kind of go into a little bit ourselves. And the last thing I wanted to read to you was a quote by Seneca. He's a first century AD philosopher. But he said there are more things to alarm us than to harm us. and we suffer more in apprehension than in reality. So, uh, so understanding and treating anxiety disorders, Barry Wolf, very very good book on that. Okay, all right. Basically, what anxiety is it's a fear of the future. Now, when I say fear, we can go to the lowest level and say words like worry, apprehension, angst, or uncertainty. Okay, these feelings, they cause this a feeling of loss. It's a loss of control, and inside our bodies, our bodies will react because our brains are sending an alarm, which we'll talk about. It's this anxiety. It's a mild reaction to the system and the circumstances. That they're no longer balanced. The system is no longer balanced. The situation or the circumstances, make it that way. It's what we call an allostatic load, which is our bodily systems trying to get back in homeostatic balance. Now, at the highest levels of anxiety are seen by us responding in a fight, flight, or freeze condition. And sometimes those behaviors produce panic-like symptoms. Anxiety from a textbook view is defined as an emotion, which I'm not totally sure I agree with in that respect. But the textbook, it's characterized by apprehension and somatic symptoms of tension in which an individual anticipates an impending danger. Remember, I told you in the future, an impending catastrophe or some misfortune. The body will often mobilize itself to meet that perceived threat. Now, the main difference between fear and anxiety is pathological anxiety is a disproportionate amount or response to a vague and perhaps unidentifiable threat. And fear is an appropriate response to a clearly identifiable threat. So, I hope you could see the distance between the two. Okay. Put this up here so I can kind of see it a little bit. Now, I also want to talk about the difference between anxiety and depression, because sometimes these two get confused, anxiety and depression. We as counselors or therapists will see clients who say they feel depressed. When during clinical exploration, when we're talking about it, it becomes apparent to them and to me, it is actually anxiety or anxiety-like symptoms beyond this feeling of funk, beyond this feeling of depression. Now, treatments are different for depression and anxiety, both in counseling realms and in psychotropic medication use. For example, for diagnosed depression, an SSRI or an SNRI is used. Now, it's selective serotonin reuptake inhibitors, SSRI, and SNRI is selected serotonin and norepinephrine reuptake inhibitors. These are used in some examples like Prozac, Paxil, Lexapro, or Effexor. Okay. Now, for anxiety, we'll use anti-anxiety medications like benzodiazepines, like Valium or Xanax. Those are prescribed. sometimes a mild tranquilizer is used, like Clonopin. Okay, that's prescribed. So anxiety is a future focused phenomenon, and depression is past focused. So what I mean is those things that we have encountered in the past, we ruminate over. It makes us sad or forlorn, and we become fixated on past occurrences. And this causes anxiety uh, because we wish we could somehow change the past. And these types of feelings are considered depressive. Okay. Now, one may say to me that, hey, Mick, I'm depressed about the future, which I've heard before. Being depressed about the future. But when we start to get down to the stories, and I listen to their narrative, and as we talk, they always seem to relate to things in the past and how they may carry forward in the future. But yes, a patient can have both depression and anxiety. What we call a comorbidity is the expression we use on that. Oh, I'm going to show you my shirt. Pink Floyd says down here. I don't know if you can see it very good. It says the dark side of your mother. So, yeah, pretty cool. I like that T-shirt. Pink Floyd, the dark side of your mom. Now, the words I'm using, please don't take don't take it wrong. Don't words I'm using like disorder, morbidity, depression, panic. Don't take them as pejorative or denoting negative connotations. In psychology, these terms do not have the same impact as in our social lexicon, our normal everyday language. So another example, just to give you a kind of an example, is the word impulsivity. It means different things between normal use and what we use in a clinical psychological use. The meaning for impulsivity is different in that respect. So when we look at these conditions, anxiety, depression, etc., they are very normal, very much so. Just about everyone at the same time in their life will suffer from clinical level anxiety, depression, or experience some form of a panic attack. So I don't mean to express anything negative. It's just a normal happening or an occurrence. I may even go as far to say is I think professionally, from having studied and encountered psychopaths and antisocial personalities, that if someone does not, at some time in their life, experience anxiety or depression, then there may be something askew in their empathy realm. The genuine feeling and connection for others in that respect. Okay. Okay. Moving on. So another thing I want to differentiate is stress and anxiety. Stress and anxiety, they're different. Okay. Stress is a person's response to daily challenges where we have changes physiologically, meaning inside of us, and psychologically. We can feel this. We can feel this change. Okay, this may be due to internal states like health-related issues. For example, overweight people are an example of health-related stress. Okay. Now, external issues like job or family dynamics is another way. So, but if you've ever raised kids, a bunch of kids, moms and dads know full well stress, okay? Short-term stress now is advantageous and helps us perform better on mental or physical tasks. in these short-term type of stress situations, the body is very much revved up, and we can feel our heart rate and breathing increase. Our heart rate and breathing increases. Uh, what healthy performance level stress does is it invokes an acuity, an ability, and focus for a short period. Okay, so understand that for short-term stress, it's not a bad thing. It's something that's needed. On the other hand, long-term stress, anxiety is unhealthy, and it degrades our body of defenses, and physical issues may manifest, especially heart disease and perhaps future dementia or cognitive problems. Okay, getting back to anxiety, the DSM, the Diagnostic and Statistical Manual of Mental Disorders, has its very own section for the disorders. And I kind of wanted to show you this here real quick. This is our recent 2013 DSM-5, and I can't remember. It's got about 700, I think. I've got it on a clipboard somewhere of different ones, but it has its own section for anxiety now. Where the old one, which I do like still, I still do use, is the 4. You can see it's a lot thicker. But this is based on what we call axes 1, 2, 3, 4, and 5. And it talks a lot about social stuff, but I think it's really good to use, and I still use this. But the 5, the statistical manual, DSM-5, is our go-to manual today, where we use the current codes and also the ICD, the International Code for Disorders for European and other places in the world. Okay, so the section on anxiety, there's different types of anxiety. First, there's GAD. Now, GAD is what a generalized anxiety disorder. GAD, GAD, generalized anxiety disorder. It's best described as this continuous keyed up feeling about nothing in particular, or it could have something specific, like a job, a family, finances, and some continue, but it's in a continuous form. Okay. GAD is a generalized worry, a sense of impending doom, where the person has a problem of really identifying their cause of worry. Next, there's separation anxiety. I'm going to try to remember all these without looking at my notes. Separation anxiety. We mostly see that in children, okay? Another category are specific phobias. Okay, now phobias are a little more centralized fear, and which cause anxiety, that are divided up into, we have phobias about animals, phobias about a person's environment, like heights, storms, or being on the water. I'm looking at Lake Guntersville, being on the water. Next, we have blood phobias, which also include unplaced fear for injections. Okay, I've treated some patients that had a fear of injections or IVs. Then there are situational phobias. Okay, airplanes, boats, elevators, public bathrooms. It's pretty common. Some of us can recall what we termed a bashful bladder or a bowel, and not being able to eliminate in public bathrooms, especially like during school or something, when there are a lot of people around. Then there's social anxiety, which I've studied quite a bit on, and I kind of like that, looking into that. But it's a fear or an angst about being around people, public speaking, or really even just being the center of attention. So in some gathering, okay, and I'm sure that for social anxiety during this pandemic, people have experiences feeling about being around others, and uh, you know, this virus that we're seeing. Lastly, the DSM-5 lists agoraphobia. Now, a lot of people have heard of agoraphobia, uh, but this is different than social anxiety in that a person, they usually won't leave a safe environment for fear. It's a phobia that something bad may happen, uh, which can include, like a fear of them having a panic attack in public. So it's just not about, leaving the house. It's about, some of them have a fear of panic attacks because it's embarrassing to them when they get into public. Okay. So why are some people more prone to having anxiety than others? Basically for two reasons. First is genetics, a generational happenstance. Okay. And second, their developmental environment, meaning family and parental dynamics and school experiences during what are known as the formative periods. Okay, these lend to an anxiety proclivity. I'm trying to get used to my new microphone, so I'll probably hit it a few times. Formative periods are when the brain is undergoing rapid and permanent change. Okay, once a person is born, the two biggest periods occur from neonate to about 4 or 5. Um, Now, the brain from birth till about 3 will increase in size about 122%. So between birth and about 5 years old are the biggest changes in that. And the other one is puberty, which normally happens between 11 and 13 for girls and 13 to 15 for boys. Now, we also have precocious puberty and late onset periods, even though they occur outside the mean or the average. Excuse me. So I'm not necessarily locked into those ages, 11, 13, 13, 15. Okay. They can either be precocious or late onset. Now, genetically, we know of certain chromosomes and genes within those chromosomes, which they choreograph what is known as the autonomic nervous system. Okay. Let me back up here. We have the central nervous system, which is our brain and spinal cord. Okay. That's our central nervous system. Then we have what's known as the peripheral nervous system. It's all those nerves that run through your limbs and through our trunk. And the autonomic nervous system, it comprises of sympathetic, parasympathetic, and the enteric systems. The enteric system is our digestive tracts. So what I want to do is I want to explain a little bit, just a really quick peek here on what the autonomic system is, and this is just really rough here. As you can see in this diagram here, we have what's called the hypothalamus. Okay. Now the hypothalamus, it makes up what we call the HPA system. It's the hypothalamic adrenal axis, adrenal, and pituitary axes. So it's hypothalamic, pituitary, and adrenal axes, HPA. Then we also have the hypothalamus and the medulla down here on the brainstem. Okay. The HPA sends hormones. As you can see, it's we have up here. It's called CRH, and I'm not going to break them down for you. What happens is the hypothalamus. It looks like when you look at it, kind of looks like a seahorse. it'll send what's called CRH. It's a hormone down to the pituitary, and the pituitary will elicit what's called HTCH, another hormone, down to our kidneys, our adrenal glands. Adrenal glands sit on top of the kidneys. Ad means above, and of course, renal is another name for our kidneys. So adrenal. So it sits on top of the kidneys, and that'll elicit norepinephrine and adrenaline, adrenaline and noradrenaline. I call it epinephrine, norepinephrine, but that's more in our brain. Plus cortisol, as you can see, is a feedback chemical, and the medulla system down here on the brain stem, it increases heart rate, or it increases the heart rate to supply blood to the major muscles away from some organs, especially the brain. That's why it's hard to think under pathologic stress or during high anxiety periods. You've been really in an anxiety stress out. It's really tough to think. So we see this scattering of thought and some language. The language is mixed up. It doesn't make sense a lot of times. But also what happens is the medulla will open up our skin pores, causing goosebumps and a feeling of cold. Now I'm talking about what happens is you can kind of notice physiologically when your HPA and medulla system gets up. So the skin pores, they'll open up, causing goosebumps and a feeling of cold. Your skin, it gets sensitized, that tactile and those peripheral systems, they become sensitized to touch. And also the medulla, it'll dilate our eyes, our pupils, so we can see more panoramically and better in lower light. And it makes our lungs operate faster by breathing more heavily. So those are pretty much the most noticeable in that respect. Okay. Now I'm going to talk about the enteric system real quick, the digestive system. It's our gastrointestinal tract. It's a part of the autonomic nervous system too. When the HPA and the medulla system activates, our bowels, they'll slow down and digestion decreases because the enteric system is impacted. Now, sometimes the opposite occurs, and the bowels and the urinary tract, they'll release. And this is due to a flooding of vasopressin and serotonin in the system. But over time, a normal settling occurs, and we'll see a decrease in our response. This is what is known as a parasympathetic system being activated and dominated, okay? But when things get really terrifying and the system can no longer cope appropriately, the parasympathetic system activates like a fire suppression, to help downregulate the sympathetic. It's like a fire suppression system. It's as a way to guard the brain and our body from damage. To understand this, think of the sympathetic as the accelerator and the parasympathetic as the brake. Even though we have both pressed down, the car, it goes nowhere, even though the engine is revving. The parasystem, it overrides in bodily fashion the sympathetic system. Now, this causes what we call disassociation, namely freezing, not being able to move, even though we are actually fully aware. I see this associated with a lot of developmental trauma, like childhood sexual abuse and other forms of abuse. Also, fainting can happen, and sometimes flag. Now, flag is a condition where one moves but doesn't feel present. It's a disassociation of non-realization. Uh, some may call it surreal, or depersonalization happens where one feels that they're not themselves. Uh, Sometimes like an out of body experience, I guess would be kind of a way to describe that. But and the most widely known dissociation order or condition is what we call multiple personalities, but we now refer to it as DID, uh, dissociative identity disorder, and it's a like I said, it's correlated with very severe childhood abuse, like torture or multiple instances of sexual abuse, and I've had several clients experience that, but they didn't have multiple personalities, but just severe disassociation in some form. Okay, there are some proven therapy treatments for these conditions. For severe anxiety like panic attacks, agoraphobia, or I didn't mention conversion disorders because they're no longer in with anxiety, but anxiety causes them a disassociation. A conversion disorder is like someone experiences something very traumatic and shocking, and they'll go blind, experience mutism, they'll lose the use of their arms or legs, etc. So it's over in what we call somatic neurobiological disorders now. I believe is a section for conversion disorders. Okay, uh, but for these, these can in treatment for these conditions like anxiety, severe anxiety. I would recommend, psychiatric medications, like we mentioned before. Of course, going to see your physician or a psychiatrist, along with the appropriate therapy protocols that we have. Okay. For mild to moderate symptoms, it might be best to wait on the results of therapy before trying pharmaceutical interventions. It just all depends. We would bring in a qualified physician or a psychiatrist to discuss that. But therapies like cognitive behavioral therapy (CBT) is used a lot. But I like to use what's called ACT, and I use it along with psychodynamic interventions like schema therapy and internal family systems. Dr. Wolf talked about that, in his book. He does the same thing along those lines because we find that there are deeper issues within the anxiety. Okay, so this covers, the therapy that I approach it with is it covers both the genetic generational aspects and also the present coping strategies needed to help heal from this condition. And this is all done from an attachment and neurological foundation. Okay, we're going to explain, how we got to this point and what's going on in the brain and the body, and then learning the apropos coping mechanisms to deal with anxiety. Okay. Now, in the book of Matthew, Christ said, He said, "Come to me, come to me, all who are weary and heavy laden, and I will give you rest. Take my yoke upon you and learn from me, for I am gentle and humble in heart, and you will find rest for your souls." Christ said, "My yoke is easy and my burden is light." Okay. So if you need to reach out to somebody and you need a referral if you're far away, just contact me at agape counselor at outlook.com, agape counselor at outlook.com, or you can private message me on Facebook, or you can call 256 599 0291. Maranatha. And until next time, God bless you, and may God bless America. Thanks, guys.